to our channel. We're going to take a little break away from the Golden Doodle puppies for a while and talk about knee replacement surgery. I'm 3 days out from having a knee replacement surgery. I just went grocery shopping and we got the ice machine today, and I've been watching some videos on YouTube, which well, you're watching mine, so I can't say I don't recommend it, but if you think that it's going to bother you or if you're going to get upset by it, then just don't watch them. I'm getting pretty nervous about it. I know that it's a good decision for me for in the future, but I'm getting pretty scared. But I know that, oh God, it's fine. Relax, Sherry, relax. I know that my husband is going to be here for me, and I know that this is going to be good for our future and everything that we want to do now that we've worked so hard since we were young kids to be in retirement, and I just can't not have a leg. So I'm excited, but I'm scared because I can't just say, oh, can I just have my bones back, please? I am exactly 1 week out from getting my total knee replacement, and this video is going to show you some of the steps that it took for me to get here, what it was like for me at the hospital, when I got home, and how the beginning of physical therapy is going, and just some of the antics of being home after a total knee replacement. It's kind of a run through or a dress rehearsal for me coming home. I wish that we would have done that. There's a couple of things, have your ice machine stocked and ready to go. Make sure that you have practiced how you're going to elevate your leg. Have your pillows, blankets, everything on your bed the way that you want them. Make sure that you know that the things that you bring home from the hospital, you're going to want your caregiver to bring into the bedroom so that you can unpack, look through, and go over some stuff with them. And then also plan your first meal. We did not plan our first lunch. I was starving from having not really eaten much in the care center after my surgery. The only thing available was just a sub sandwich, and it wasn't that great. Not their fault. It was just that everything was closed by the time I had gotten there. And so Todd and I stopped on our way home and got a to-go sandwich, and just that extra stop and length of time of me being in the car really kind of added to the irritability. So make sure you have that first at least 1 or 2 day meal planned and prepped so that that's not something that you have to worry about. All right, I'm going in. They say I'm in lucky room number 7. Here we go. You guys, this doo-wop is awesome. It's like, look at, it's filling with warm air. It's hooked up to this thing, and it's got warm air. It's awesome. I'm still just sitting in here, so I'm just hanging out with this air mattress blanket thingy and surfing the internet. It's 11:04. All right, we got the doctor's signature. Okay guys, I'm back. I have plenty of pain pills and stuff, so I'm feeling pretty good. And I'm gonna be getting dressed here and heading over to the hotel, I guess within an hour. So I'm back. Getting ready to head out. I'm too sexy for my pants. Too sexy for my pants.
Too sexy for my pants. Too sexy for my pants. Just waiting for the bus. Okay, dudes, I'm in this hotel. Got a little blood pressure machine, a bed, and there's like 5 other patients here, and there's like a home health aide nurse that comes around, and got some water, and I'm just hanging out in this chair. So guys, I just went out and did another walk. It's 20 minutes to 11, and I'm not in the amount of pain that I thought I would be in. It's stiff and that kind of thing, but I feel pretty good. I'm sure that I'm probably looped up as hell, but it's not bad. I actually just fell asleep for a while and stuff, so yeah, it's going pretty good. That's good.
When I first got home after Todd picked me up, it was a little tense. I wish that we would have kind of talked over or known ahead of time what we would have wanted to do with me once I got home. The things that I wish that we would have done is, first of all, the morning that I got discharged from the care unit that I was in, everybody was busy discharging other people. I had to do my physical therapy, and the one thing that they didn't do is to give me a pain medication before I left. And so by the time I got home, I was really uncomfortable and just getting really in pain and irritable. So after I talked to the nurse after discharge, she said that they should have, dosed me with something to keep me comfortable to get through the transition from the car to home. So that would be one of the first things that I wish that we would have done differently.
Okay, so it is around noon the day after my surgery. Those are veins, they were there. And my knee's feeling good. I haven't been able to get it this straight in years. And I just did some physical therapy, and now we're just waiting for the toad to come and pick me up. And I got this fancy merch, this walker to take home with me. So, hey, I'm here for the free stuff. I feel like I have a few obstacles in my way today. Hey guys. Hey. Just got done with a quick little physical therapy appointment. I'm glad we brought this ice pack with to wear on the way home.
When you first come home from the hospital, you have several medications that they're going to have you taking, from just pain pills to blood thinners, stool softeners, everything that you can imagine. And there's absolutely no possible way that you can keep track of all that on your own. They do give you a sheet, but Todd is my dealer. He is the only one that messes with the medication. And if he's going to be gone, or if there's something that I can take in the night, he sets it out and writes down what time would be the earliest that I can take it. So that way we know that I don't, in a stupor or half awake or whatever in the middle of the night, take too much, Rain's chewing on a shoe, take too much medication. So you want to make sure that you have that agreement with that person, at least for the first couple of days, so that you can get used to what you're taking, how to take it, and when to take it. And speaking of pain management, we rented an ice machine. And my physical therapist told me yesterday that a lot of people say that they don't think that they need or want that. It is not covered under your insurance. It's $300 to rent for a month. And I would say that if you are thinking of not getting one, you should go through your house right now and start selling your stuff so that you can get one. There's no way that that wraparound ice pack that they send home with you is going to help keep the swelling down or keep your pain levels to where they need to be without it. It is just, I can't imagine. You would have to, that ice pack that they send home with you to wrap around your knee is great, but at first it's too cold and it doesn't last. With the ice machine, it's a little compressor. Think of it as like a blood pressure cuff that runs cold air through it. And is what our sales rep recommended to us, is that we get these small bottles of water and freeze them. And then we just keep trading out these bottles of water in and out of the well where the ice goes. And then that way we're not constantly needing to buy or keep our ice maker keep up with that. And I mean, the pain is a lot more bearable than I thought it was going to be, but like I'm wearing one earring because after I woke up from the surgery, I put my earrings back in and I like re-pierced my ear. Seriously, like went through not the hole. So it's, you're not going to be in your clear frame of mind for a while. And you want to make sure that you set yourself up with these tools and resources so that you can get through the first few days, and then that will start your healing off to where it needs to be.
They said you're not going to hurt anything. Got to give her a couple of tries here.
Yeah.
Not with the good one.
Okay. I'm trying, honestly, I am.
Well, that's good. You don't have to have a full range. Just even if you're just flexing that muscle, you'll eventually get it to fire.
I feel like I'm the weakest person on the planet. Here, will you help me lift it a little bit?
Okay, throw it.
Okay, now we're gonna do the slide. So, I'm gonna lay back. Uh-oh, that's all the further I can go.
That's a great start. Seems like every time you do it, it gets a little better.
Okay, that's enough.
You gonna start swearing and cussing now at me? All right.
I feel like I have a few obstacles in my way today. Hey guys. Hey. Can you let me out? No, really. Can you let me out? So, this is what I'm trying to do. And that, believe it or not, is a huge effort. This might be cheating, but damn it, I want progress. Back to the ice.
Okay, so in about an hour, I will have gotten home exactly 1 week ago. So where am I at? How do I feel? First of all, I've not been taking the narcotics more than just in the middle of the night if the pain has gotten really bad. The Tylenol that they have given me to take seems to be just holding the pain where it is. I do have to stop and ice probably at least every hour or so, and my leg is almost always elevated. But as far as excruciating pain or anything like that, I haven't experienced that. The doctors and nurses at the care facility were extremely great with me, and Todd has just been right on top of all, keeping the ice machine restocked, making sure that the medication gets distributed properly, and making sure that I'm able to stay in bed with my leg elevated, and then also doing the exercises and movement. So we seem to have found the right balance, is what I'm trying to say. It's discouraging. I still can't do like a straight leg lift, and I also can't just lift my knee from the knee down. Like I can lift my upper thigh up, but I couldn't, sitting in the chair, I couldn't just kick something with that leg. But just over the past few days, that ability has increased greatly every day. So somebody that I work with tells me not to rush the process. So I'm trying to be really, really patient and listen to that great advice that I got.
Thanks for watching this video about my knee replacement. Please subscribe so you can see what we're up to next.